If the NHS gets overwhelmed with very ill COVID-19 patients, what should healthcare workers do? Who gets a bed? Who should have a ventilator? Who gets priority? For the UK's 240,000 doctors, it will be down to them to decide. And while they wait for the government to issue official guidelines, the British Medical Association have given their own advice to doctors today. These are the worst case scenarios they may be thinking about in the weeks ahead. Doctors are used to making life and death decisions, but in a pandemic, if the system is under intense pressure, what should they do then? Their professional association has come up with these guidelines to help in some of the most challenging decisions they'll have to make. When it comes to age, the BMA says a cut-off would be unlawful, but older patients with severe respiratory failure may have a very high chance of dying and would be lower priority for admission to intensive care. Patients who are ill in the early stages of the pandemic are more likely to be cared for in intensive care and get a ventilator than those who become similarly ill later. The BMA also says that we may reach a stage where priority over treatment would be given to essential workers to keep the health service and other key sectors running and limit economic losses. But they say it's up to the government to decide who these people are and not doctors. These decisions have already been made in countries which have had high numbers of deaths from COVID-19, like Italy, China and Spain. Medical ethics expert Dr. Jonathan Ives welcomes the advice.
So I think it is certainly a good idea to have this guidance out so that people have time to digest it, so that there's time to have a public conversation about it. Because it's very important that the public are aware of and are involved in these kinds of discussions and decisions as far as possible.
We're still waiting on the government here in the UK to issue their guidance on what doctors will potentially have to do. Likewise, updated advice on who gets personal protection equipment is still an issue yet to be tackled by them. Currently, only people dealing with COVID-19 patients have high priority over this equipment.
Everyone on the front line in hospitals should be wearing PPE at all times. And that's really important because it is now very clear that there are a lot of patients that are asymptomatic, which means they have no symptoms whatsoever, that are able to transmit virus.
As the pandemic progresses, unions for healthcare workers are looking to the government to give them clear guidelines on how to make some of these tough decisions.
Aisha Tull reporting. Well, joining me now from London is Julian Sheather, a special advisor in ethics and human rights to the British Medical Association. People will wonder what this means in real terms. Does it mean that if you have a potentially life-limiting condition, whether it's heart disease or something else, doctors would be correct to put you further down the list of priorities for treatment when it comes down to it?
I think it's absolutely essential that we recognise that nobody wants to be making these kinds of decisions. But if we do get to a situation where resources are absolutely overwhelmed by need, the question arises is what does fairness in the distribution of those life-saving interventions look like? And one of the issues that will be put into place are questions around capacity to benefit. As I say, to repeat, if resources are overwhelmed, questions about how to prioritise, how best to distribute those resources become urgent.
Yeah. Now, the guidelines say it shouldn't just mean that age means that you don't get treatment.
Absolutely.
But
absolutely.
In what scenario would an older person be prioritised over a younger person?
If, for example, the older person was fit and healthy and the younger person had underlying comorbidities that meant they were very unlikely to benefit from the intervention, then the older person would be prioritised. What we're interested in is identifying clinically relevant factors for the distribution of these resources. Age in and of itself will not be a clinically relevant factor unless it is associated with underlying morbidities.
I mean, how helpful do you think this is as a public debate? I mean, do you actually want people to think about whether they should be going to hospital themselves? Is that kind of what the purpose of this is, for families to decide whether they should try and go into intensive care or whether they should actually die at home?
I mean, the guidance is it's principally faced towards medical professionals, trying to support medical professionals when they are confronting these incredibly harrowing decisions. They don't want to make them. Nobody wants to be here. I also think it's an excellent idea that people decide in advance how they might like to be treated if these circumstances arise. It's a matter of individual choice and freedom and autonomy, and we strongly recommend that people start having those conversations now.
Do doctors want a firm set of guidelines to be handed down to them, or are they happier working within the framework they've always worked with and with these sorts of guidelines themselves?
One of the things we want to ensure, well, a number of things we want to ensure. We want to ensure that doctors are supported, feel confident when they are forced to make these harrowing decisions. If we can get centralised advice and guidance from the government that our guidance can lock into, then so much the better. It's far better if the government and the profession speak with a single voice on these issues. That will give confidence to doctors, and it'll give confidence to patients that these decisions are made as fairly as possible in these demanding circumstances.